There's a significant risk when a patient develops symptomatic COVID-19 that they'll develop some evidence of myocarditis. This is an inflammation of the heart muscle triggered by the virus. Now, sometimes the virus attacks the muscle directly. That's viral cardiomyopathy, and sometimes we develop cardiomyopathies because of the body's autoimmune response or immune response to the virus. It also attacks our heart tissue. The bottom line is that results in heart dysfunction, congestive heart failure, fluid building up from the heart into the lungs, and can result in significant arrhythmias like we've talked about. Atrial fibrillation's the most common arrhythmia caused or worsened by COVID-19. Ventricular tachycardia and ventricular fibrillation, which cause sudden cardiac death, can be seen in patients that have significant cardiomyopathies. Patients show evidence of myocardial injury or heart attack when they're having acute COVID-19 infection. Often their cardiac enzymes are elevated, showing some evidence of injury to the heart. Most of those patients do not have a blockage or a new narrowing of the artery. It's just due to the virus directly attacking the muscle. There is increased risk for a typical or traditional heart attack with COVID-19 as well, because it tends to be procoagulant, cause blood clots. It changes your clotting cascade, and patients tend to have higher risk for clotting off the arteries of their heart or throwing blood clots to their lungs, called pulmonary emboli. And COVID-19 increases the risk of both of those things. So we have seen more patients coming in with what we call ST elevation myocardial infarction, or blood clots clotting off an artery of the heart with COVID than we saw before COVID. So what do we do about that? Well, we treat them like anybody else. We put masks on and appropriate PPE and figure out what's going on and take care of it. Common sense, social distance, wear a mask, and stay away from people who are infected if possible. And I guess probably most importantly, get the vaccine. I'm a strong believer in getting this COVID-19 vaccine because it's been shown on thousands and thousands of patients, one, to be safe, and two, to be effective, reducing the risk of getting COVID-19 by about 90 to 95%. The vaccine is a tool that we did not have available until last month, and it's probably the one thing that's going to allow us to get back to normal.